Hello and welcome to ESPN. Tonight, for the updated disabled list for the Texas Rangers, we have quite a few players. Mitch Moreland, a DH, is out with a sore shoulder. He's waiting on an arthroscopy to look at the joint and assess the damage to see if arthroplasty is necessary. The next few are pitchers, putting the Rangers in a tight spot with having this many players out. Yu Darvish is out for the season after hyperkinesia of his elbow during spring training. Matt Harrison is recovering from a discectomy of the lower herniated disc. And the last one I'll touch on is Derek Holland, who's sitting out because of a subscapular sprain on his left shoulder. This has been the ESPN MLB Minute. Over to you, Courtney.
Thanks, Riley. Now to Gregory softball. It was released early this morning that last year's Player of the Year, third baseman Kennedy Mendel, will be missing the rest of her junior season. She went in to see an orthopedist last week about pain she had been experiencing in the lumbar region of her back. She was told by the doctor the possible causes of the pain included spondylosis, spondylolisthesis, and spondyloarthritis, but he could not say for sure until she had an MRI done. She went in early this week for the MRI and it found out that she is suffering from spondylolisthesis. There were a few options for treatment, but the decision has been made that she will go in for spondylolisthesis surgery. This has been your softball update. Now over to you, Gregory.
Hi, today I'm going to be taking a look in a basketball player's injuries. The player that I chose today to be looking into will be Kobe Bryant. Throughout this young man's career, Kobe has been through so many injuries it is almost amazing he is still in action and producing amazing unheard of stats. Starting his career in 1996 and still continuing to shine, Kobe has had his share of pain and glory. Kobe's first injury occurred in 1996 with a strained hip flexor, only disabling Kobe from one game. A hip flexor strain is an injury commonly known by tearing one or more of the muscles located in the front part of his hip or groin. In 1999, Kobe fractured a metacarpal, which is a bone in his hand. As you can imagine, trying to play basketball with a broken hand is quite impossible. Kobe missed 15 games to recover. To fast forward a bit to 2003, Kobe suffered a laceration in his index finger, causing him to miss 7 games. A laceration is when the skin is sliced below the surface and damages the soft tissue underneath. In 2004, Kobe suffered a severe sprained ankle. An ankle sprain is when there is damaged ligaments in the ankle due to the ankle being forced in an awkward direction. As 2009 arrived, Kobe experienced an avulsion fracture in his right index finger. The word avulsion is described as the act of tearing or pulling away. Sounding as awful as it does, Kobe only missed 2 games. A little later on, in 2011, Bryant developed tenosynovitis in his shins. Tenosynovitis is inflammation and swelling of a tendon caused by repetitive movements. Thank you for tuning in with me on this insight of Kobe's injuries.
It is that time of year where spring football games are hosted all across the nation at universities. This is the last time of the spring that incoming freshmen will have a chance to show off their skills and see live game action until the fall semester begins. I will be touching on several players and their injuries to keep an eye out heading into the annual blue and gold game held every year on the campus of Notre Dame. Jerron Jones, he's a defensive lineman. He suffered a metatarsal injury last season, and this is more commonly referred to as a Lisfranc injury. He looks to be 100% heading into the end of the spring and for the beginning of the fall season. Drew Tranquil, he suffered a torn anterior cruciate ligament, which is more commonly referred to as an ACL. He has been rehabbing and looks to be back to 100%. Cole Luke, he missed several contests last fall due to a concussion, but after an off-season of rest, he appears to be healthy again. Amir Carlisle was hobbled last season by a medial collateral ligament injury, and he has had the off-season to rehab and rest, and he looks like he is back to being the same speedy playmaker that the Irish are used to seeing. And last but not least, Jarrett Grace. In 2013, he suffered a fractured fibula, and he missed all of the 2014 season, but due to continuous rehab and many setbacks, he is finally looking like he is the leader that the Irish need to lead their defense in 2015. Now, on to you, Jacob.
I'm going to be discussing 5 common sports injuries. The first one is the Achilles tendon rupture, commonly known as a torn Achilles. This occurs when performing explosive acceleration activities and the tendon simply breaks. The second is the muscle contusion, commonly known as a muscle bruise. This is when someone is hit by a direct blow or multiple blows from a blunt object, and it results in the underlying muscle fibers and connective tissues to be crushed without breaking the skin. The third is known as the acromioclavicular separation, commonly known as a separated shoulder. This happens in the event that someone is forced to the ground on either shoulder and results in the ligaments that connect the shoulder to the clavicle to be completely torn and causes a separation-like appearance. The fourth is the metatarsal phalangeal joint sprain. This is also known as turf toe. This happens when the big toe is hyperextended due to someone or something falling back on the calf, and as a result the connective tissue in the big toe is injured. And the fifth one is the tricep sprain. This occurs by sudden trauma to the triceps when they are overused or worked too hard and cause to become injured and inflamed. After this, they are easily susceptible to tearing or rupturing.